If you're over 70, you've probably been told that staying on top of your health means getting more checkups, more scans, and more tests. It sounds responsible. After all, prevention is better than cure, right? But what if some of those tests, the ones meant to protect you, are actually putting your health at risk? Every year, millions of older Americans go through screenings that lead to unnecessary treatments, surgeries, medications, or lifelong side effects that may never have been needed in the first place. And the scary part? Most of them have no idea it's happening. Hi, I'm Dr. Michael Reynolds, and today we're uncovering 5 common medical tests that can do more harm than good after age 70. You'll learn what the latest U.S. research says about each one, what to do instead, and how to make smarter choices for your health with confidence, not fear. Because after 70, your goal isn't just to find disease. It's to stay strong, mobile, and joyful for as many years as possible. Here's what we'll cover in this video. Why one popular harmless scan can quietly ruin your quality of life. How a brain MRI can accidentally create anxiety and even unnecessary surgery. Why some heart tests can lead to more hospital time than healing. When a colonoscopy becomes riskier than helpful. And finally, the test that experts now link to nearly 5% of all cancers in the U.S. and how to protect yourself from it. Everything I'll share is based on research from trusted institutions like the Mayo Clinic, Johns Hopkins, Harvard Health, and the American Geriatric Society. And I'll give you real-life stories from patients who learned the hard way that more testing isn't always better care. So grab a cup of tea, get comfortable, and stay with me, because this information could save you from unnecessary pain, fear, and procedures that don't improve your life. Let's begin with a test that almost every senior has had, and that sounds completely harmless. But for many, it leads to medications that do more harm than the condition itself. Number 5. Bone density scan, DEXA scan. If you've ever been told you need a bone density scan to check for osteoporosis, you're not alone. It's a simple, painless X-ray that measures how strong your bones are. Doctors often recommend it after menopause or once you turn 65. But here's what few people over 70 are told. By that age, almost everyone's bone density looks lower, even when there's no real danger. That's because some bone loss is completely normal with aging. It's like getting wrinkles or gray hair, part of the natural process. Yet the scan results often sound alarming. Words like osteopenia or low bone mass can make anyone feel fragile overnight. And that fear often leads doctors to prescribe strong bone medications like bisphosphonates, drugs meant to harden bones. But these medications can have harsh side effects. They can irritate the stomach and esophagus, cause muscle or joint pain, and in rare cases, even lead to jaw necrosis, a condition where part of the jawbone starts to die. According to a 2021 Harvard Health Review, treating mild bone loss in adults over 70 with medication rarely changes fracture outcomes, meaning most people don't actually benefit, even after years on the drug. Let me tell you about Rose, a 76-year-old retired piano teacher from Illinois. She felt great. No falls, no bone pain. Her DEXA scan showed mild osteopenia, and she was immediately put on a bisphosphonate. Within months, she developed acid reflux and jaw pain. When her new doctor reassessed her, they realized she never needed the drug in the first place. Instead, Rose started a simple natural routine. 20 minutes of resistance band exercises 3 times a week, vitamin D and calcium through food, like sardines, almonds, and leafy greens, daily walks in sunlight. A year later, she hadn't had a single fracture. In fact, her balance, strength, and confidence had all improved. And that's what modern science confirms. A 2022 study in Osteoporosis International found that seniors who focus on strength training, balance exercises, and vitamin D optimization reduced fracture risk by over 20% without medication. So if you're over 70 and haven't had any fractures, talk to your doctor before rushing into bone drugs. Ask questions like, is this medication truly necessary? Can I improve my bone health through lifestyle first? Your bones are living tissue. They respond beautifully to movement, sunlight, and nutrition, often better than to pills. And here's a bonus insight from the Mayo Clinic. Short daily bursts of muscle-loading exercises like standing on one foot, climbing stairs, or light squats can significantly increase bone strength in older adults. Remember, your bones don't need to be perfect. They just need to be functional. Focus on strength and balance, and you'll protect yourself far better than a number on a DEXA report ever could. Now, if you thought bone scans could be misleading, wait until you hear about the next test. It's one that sounds smart and high-tech, but can quietly create fear, confusion, and even lead to unnecessary brain surgery. Let's talk about the Brain MRI for memory loss. Number 4, Brain MRI for memory loss and cardiac stress test. Let's start with this question. Have you ever forgotten a name, misplaced your glasses, or walked into a room and wondered why you went there? For most people over 70, that's a normal part of aging, not a sign of dementia. But many seniors panic when forgetfulness happens, and doctors, often wanting to help, order a brain MRI to rule out Alzheimer's. It sounds reassuring, a high-tech scan that looks deep inside the brain. But here's the truth. For most older adults, a brain MRI rarely provides useful answers. In fact, it often leads to more anxiety, more testing, and sometimes unnecessary risky procedures. A 2021 study published in Neurology Today looked at over 3,000 MRIs in adults aged 70 to 85. 86% of those scans showed abnormalities, things like white spots, small vessel changes, or minor shrinkage. But here's the key. 97% of those findings were completely normal for age. Those abnormal results didn't cause memory loss, and most didn't need treatment. Yet once people see something wrong on a scan, fear sets in. That fear can trigger a chain of unnecessary spinal taps, biopsies, or medications, all of which carry risks. Take George, a 74-year-old retired engineer from Ohio. He started forgetting names occasionally, nothing major. His doctor sent him for an MRI just to be safe. The scan showed white matter spots, which terrified him. He stopped driving, avoided church, and convinced himself he had dementia. But when we did a standard cognitive screening, a simple paper test used by neurologists, George scored perfectly normal. His brain changes were simply signs of healthy aging. So instead of more tests, we focused on lifestyle. 7 to 8 hours of sleep each night. Sleep clears toxins from the brain. Daily walks to improve blood flow. Crossword puzzles, and name games to stimulate memory hydration, because even mild dehydration worsens brain fog. Within 3 months, his memory improved, and so did his peace of mind. That's why many neurologists today recommend starting with a cognitive screening test before any brain imaging. It's low cost, quick, and far less likely to cause panic or unnecessary follow-ups. According to Johns Hopkins Medicine, MRIs are only helpful if you have sudden symptoms, like seizures, rapid confusion, or dramatic behavior changes. Otherwise, managing lifestyle factors like sleep, stress, and heart health is far more effective for preserving memory. And if you want to support your brain naturally, the Mind Diet, a blend of Mediterranean and DASH diets, has been shown in multiple Harvard studies to slow cognitive decline by up to 53% in older adults. It's simple. Eat more berries, olive oil, nuts, leafy greens, and fish, and limit fried or processed foods. So before you schedule that MRI, just in case, remember, most memory lapses are not diseases. They're signals from your brain asking for better care, not more imaging. Now, let's move to another test that's just as common and often just as misleading: the cardiac stress test. Number 3, cardiac stress test. This one sounds like common sense. Check how your heart performs under stress to catch problems early. And for people with clear symptoms like chest pain, shortness of breath, or fainting, it can be life-saving. But for many adults over 70 who don't have those symptoms, a stress test often leads down a dangerous path. Here's why. After age 70, the false positive rate, when a test says there's a heart problem but there isn't, can be as high as 40%, according to JAMA Cardiology. That means almost half of seniors who take this test could be told something's wrong when it's not. What happens next? They're sent for more invasive procedures like angiograms, stent placements, or even bypass surgeries. but these come with serious risks: bleeding, kidney injury from contrast dyes, or infections. A large 2017 study in JAMA Cardiology found that more than half of stents placed after stress tests provided no improvement in survival or quality of life. In other words, people didn't live longer or feel better. Let me share Raymond's story. He's a 75-year-old retired postal worker who loved walking every morning. One day, he mentioned feeling tired on steep hills. His doctor ordered a stress test just to check. The test showed an unclear result, so he was sent for a cardiac catheterization. Doctors found a mild narrowing, not dangerous, but placed a stent anyway. That night, Raymond developed kidney complications from the contrast dye. He spent a week in the hospital, and months later, his fatigue hadn't improved because it wasn't a heart issue at all. He was simply dehydrated and undernourished. If you're not having active cardiac symptoms, the stress test may not be your friend. Better options include a resting EKG, which checks your heart's rhythm safely and quickly, a coronary calcium scan, which uses low-dose radiation to assess plaque buildup without triggering unnecessary procedures. The Cleveland Clinic advises if you can walk, garden, or do light exercise without chest pain, dizziness, or breathlessness, your heart is likely doing fine. And for everyday heart health, focus on what really works. 30 minutes of brisk walking daily, or 15 minutes twice a day. Omega-3 fats from salmon, chia, or walnuts. Stress management through breathing exercises or Tai Chi quality sleep, because lack of rest increases blood pressure and heart strain. One of the most powerful habits, according to Harvard researchers, is the daily gratitude walk. Just 10 minutes of slow walking while mentally listing things you're grateful for can lower cortisol, stabilize blood pressure, and boost cardiovascular resilience, especially in people over 65. Your heart doesn't need more fear. It needs rhythm, movement, and peace. Tests can't replace those. Now let's move on to the next one, a screening test that nearly every senior has had. But after 70, it becomes far riskier than most people realize. And yes, it's one that doctors are now rethinking nationwide. We're talking about the colonoscopy. Number 2. Colonoscopy and full-body CT scans plus reflection and recap. Let's talk about one of the most common and most misunderstood screenings for older adults, the colonoscopy. It's often described as routine, something everyone should do every 10 years after 50. But after age 70, and especially beyond 75, this test can quietly become more dangerous than helpful. Here's why. Colonoscopy is an invasive procedure. It involves fasting, taking strong laxatives, and undergoing sedation while a long camera examines the colon for growths or polyps. It's effective for detecting early cancer in middle-aged adults, but in people over 70, the risks start to outweigh the benefits. The preparation itself can be tough on the body. Older adults lose more water and electrolytes during bowel prep, which increases the risk of dehydration, dizziness, or kidney issues. Then comes the sedation, which can temporarily affect brain function and balance for days, raising the risk of falls. And the procedure itself carries its own dangers. A 2019 JAMA internal medicine study analyzed data from over 1.3 million Medicare patients. It found that for every 1,000 colonoscopies done in people over 75, only 2 lives were saved, but more than 20 experienced serious complications, including bleeding, perforations, or heart rhythm issues. That's a 10-to-1 risk-to-benefit ratio. Now let's meet Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She was in great health, no bleeding, no pain, and had already had 2 clean colonoscopies in the past. But her new doctor insisted on another just to be safe. During the procedure, a small polyp was removed. That night, Dana developed severe abdominal pain and fainted. Doctors discovered a bowel perforation, a small tear, and she spent 9 days in the hospital recovering. The polyp they removed, benign and slow-growing. It would never have harmed her. Stories like Dana's are why the U.S. Preventive Services Task Force now recommends stopping routine colon cancer screening at age 75 for most people. Even the American College of Physicians agrees colonoscopy after 70 should only be considered if you have symptoms or a strong family history. But here's some good news. You don't have to give up screening altogether. There are non-invasive alternatives that work just as well for most seniors. The FIT test, a simple at-home stool test that checks for hidden blood. The Cologuard DNA test, which detects early cancer markers without sedation or PrEP. These are safer, easier, and can still catch the vast majority of concerning cases. If you want to stay proactive, talk with your doctor about switching to these lower-risk options. And don't forget, lifestyle still matters more than screening frequency. A diet rich in fiber, hydration, and daily movement all support colon health naturally. Think of Mediterranean staples, olive oil, lentils, whole grains, and colorful veggies. Now, speaking of high-risk scans, let's move to the #1 test on our list. The one experts are now warning against more strongly than ever before. #1, the annual full-body CT scan. It's often marketed as the ultimate peace of mind, a way to catch cancer early. Private clinics even sell it as a VIP package. One scan, every organ, total protection. But behind that promise lies a serious hidden danger. Full-body CT scans expose your body to high doses of ionizing radiation, the same kind of energy that damages DNA and increases cancer risk over time. Each scan delivers around 10 to 20 millisieverts of radiation. That's equivalent to about 500 chest X-rays in one sitting. And here's the most shocking part. A 2023 JAMA internal medicine study found that up to 5% of all cancers in the U.S. may now be linked to medical radiation exposure, especially from CT scans. That means 1 in 20 cancers could be caused by the very scans designed to prevent disease. Even worse, these scans often pick up harmless things, small nodules, cysts, or calcium spots that look suspicious but are completely benign. But once they're found, doctors have to investigate. That leads to more scans, more biopsies, more fear, and sometimes unnecessary surgeries. Meet Marcus, an 80-year-old retired martial arts instructor. He was healthy, active, and feeling great. During a premium executive health checkup, he agreed to a full-body CT scan. It showed a tiny 3-millimeter nodule in his lung, the kind that's common in older adults. But his doctor referred him to oncology. That led to a PET scan and then a needle biopsy, which punctured his lung and caused a partial collapse. The nodule, benign. But Marcus spent 2 months recovering from a procedure he never needed. According to the American College of Radiology, full-body CT scans should never be used for routine screening in healthy adults. There's no proven benefit and very real potential for harm. If you ever do need imaging, make sure it's targeted, focused only on the area of concern, and always ask, what's the radiation dose? Are there safer alternatives like ultrasound or MRI? How will this scan change my treatment plan? The truth is, you can't scan your way to health. What truly protects you is awareness, not over-testing. And your body already gives you powerful clues when something's wrong, changes in energy, appetite, sleep, or strength. Instead of reacting with fear, respond with curiosity and care. A healthy lifestyle, daily movement, whole foods, social connection, and stress management does far more for long-term health than any annual scan ever could. Final reflection and key takeaways. So let's recap the 5 tests you should reconsider after 70. Bone density scan, DEXA, useful only if you've had fractures or are at high risk. Otherwise, focus on strength training and vitamin D. Brain MRI for memory loss. Skip it unless you have major neurological changes. Start with simple cognitive screening instead. Cardiac stress test. Helpful for chest pain, but not for general fatigue. Try lifestyle-based heart care and low-risk scans. Colonoscopy. Stop routine screenings after 75. Switch to stool-based home tests if needed. Full-body CT scan, never for routine use. The radiation risks outweigh any potential benefits. Modern medicine is powerful, but it's not perfect. Sometimes less testing means more living. As Dr. Danielle Offrey from NYU Langone once said, good medicine is knowing when to act and when to stop acting. So take a moment to breathe, reflect, and remind yourself. You can't stop aging, but you can age wisely. You can build strength, protect your mind, and stay active without letting fear drive your decisions. Now, I'd love to hear from you. Have you or someone you know ever gone through a test or procedure that turned out to be unnecessary? What did you learn from it? Share your story in the comments below. We read everyone. And if this video helped you understand your health a little better, please give it a like. And subscribe for more trusted science-backed health insights for life after 60. Because aging well isn't about doing more. It's about doing what truly matters. Thank you for watching, and stay strong, stay informed, and stay kind to yourself.